On March 10, 2025, Tanzania confirmed its first 2 cases of the Mpox virus. This disease, once rare, has been spreading across Africa. Now it has reached Tanzania. One of the first cases is a truck driver. He traveled from a nearby country to Dar es Salaam, Tanzania's largest city. This shows how easily the virus can move across borders. Health officials are worried. They are working to find anyone else who may have been exposed to the virus. The arrival of Mpox in Tanzania is a serious concern. The country's healthcare system faces many challenges. Resources are already stretched thin. A widespread outbreak could overwhelm hospitals and clinics. This is why it is so important to act quickly to contain the virus. Mpox is a serious disease caused by a virus. This virus is part of the same family as the smallpox virus. Thankfully, Mpox is not usually as deadly as smallpox, but it can still make people very sick. In some cases, it can even be fatal. The virus spreads through close contact with an infected person or animal. One way Mpox spreads is through direct contact with the sores or rashes caused by the virus. It can also spread through contact with an infected person's saliva or respiratory droplets. These droplets are released when an infected person coughs or sneezes. People can also get Mpox from touching materials that have been contaminated with the virus. This includes things like bedding, clothing, or towels. The current Mpox outbreak began in the Democratic Republic of the Congo back in 2024. Since then, the virus has spread to many other countries in Central and East Africa. This includes countries like Burundi, Kenya, Rwanda, Uganda, and now, Tanzania. Unfortunately, the outbreak has been particularly severe in the Democratic Republic of the Congo. Thousands of cases have been reported there. Sadly, many people have also died from the virus. The situation in Tanzania and other affected African countries is worrying. Healthcare systems in these countries are often understaffed and under-resourced. This makes it difficult to respond effectively to a large-scale outbreak. The outbreak highlights the inequalities in healthcare access and resources between different parts of the world. Section 4. Global Alarm and the WHO Response. The World Health Organization, or WHO, is a global health organization. They work to protect people from health threats around the world. The WHO is very concerned about the Mpox outbreak in Africa. They declared it a public health emergency of international concern in August 2024. This is a very serious alert. It shows that the WHO believes the outbreak is a threat to global health. The FIIC declaration has helped to focus international attention and resources on the Mpox outbreak. The WHO is working with countries around the world to coordinate a response. This includes things like surveillance, tracking the spread of the virus, preparedness, helping countries get ready to respond to outbreaks, vaccine access, making sure that vaccines are available to those who need them, and community collaboration, working with communities to raise awareness about Mpox and how to prevent its spread. Section 5. Protecting yourself and others. There are things you can do to protect yourself and others from Mpox. One of the most important is to practice good hygiene. Wash your hands frequently with soap and water. Avoid close contact with people who are sick. If you do need to be around someone who is sick, wear a mask. There are vaccines that can help protect people from Mpox. The WHO recommends 2 vaccines in particular. These vaccines have been shown to be effective in preventing Mpox infection. They are working to increase access to these vaccines in lower-income countries. If you are traveling to a country with an active Mpox outbreak, talk to your doctor about getting vaccinated.